Hello, I'm Tu Kim Lam. Welcome to the Medical News. In this edition of the Medical News, we will talk about kidney stone, which is one of the most common kidney disorder affecting more than 1 million Americans each year. Here with us today is Dr. Tran, who is currently practicing internal medicine in Falls Church, Virginia. He will share with us the information on kidney stone and the most updated news. Please join me to welcome Dr. Tran.
Hello, welcome to our shows, and again, hello, Mrs. Lam.
Hello, Dr. Tran. Today we can talk about kidney stone. Kidney stone is one of the common disorder of kidney disease. According to some of the archaeologists, that they found Egyptian mummy that was buried 7,000 years ago. This has kidney stones already, so which telling us that this disease has been for a long time. They are not a new phenomenon. So before we talk further into the detail, would you please explain to our audience what kidney stones are?
Well, the kidney stone is present of the materials in the urine that they form when there's high levels of the certain substance in the kidney. Remember, the kidneys really filter the blood and to try to get rid of the extra waste in the blood. For instance, urea, oxalate, or any other substance, chemicals in the blood that's supposed to be eliminated by the kidney. Therefore, when they have the high concentration of these substances in the urine, they have the tendency to combine and forming stones. The stone may have different sizes. They have a very small, have a very big stone, depending on how many years it's been in the kidney. Therefore, sometimes we can see the people with kidney stone will never have any symptoms because it's been there for a long time. Now, the people may have very severe symptoms related to the stone because the small stone and try to go down to the ureter and causing the obstructions of the urinary tract system. So this is the disease related to the kidney stone that we want to talk about today.
Kidney is one of the elements in the urinary system. When we're talking about kidney, we cannot forget about the urinary system. First of all, briefly, can you tell our audience where is the location and what the function of the kidney, also how the urinary system works?
When we're talking about the urinary tract system, this is a system composed of two kidneys. You can see on the screen. The kidney is the most important part of the urinary tract system because when they filter the blood, the urine will come down to the ureter. You can see on the screen. Then through ureter, the urine will go down to the bladder. And the bladder, the function is just really to contain the urine. And then when the urine is getting enough, then they will signal the brain that helping the person to get the signal to go to the bathroom to urinate. So this is how the function of the urinary tract system. But the key of that system is the kidneys. If you can see it, the kidneys with the size very small, like a fist of the hand. Usually it measures about 10 to 12 centimeters in length. But the function is really just amazing because since we was born, the kidney function up until the person's passed away. Every day, the kidney will filter a lot of, at least 40 liters of blood go through the kidney. Now, if you can look at the kidney, they can filter that much blood and making at least about 1 liter to 1.5 liters urine a day. How they can do that? If you look carefully at the kidney, you can see inside the kidney, they have the cortex, and then they have the empty space in their medulla to collecting all the urine filter out from the kidney. If you look carefully up on the detail of the cortex, you can see about thousands of small, tiny collecting tube in there. That collecting tube is come from a small unit of filter called glomerulus. Glomerulus is about 1 million of glomerulus in the small, tiny kidney. That unit has the function of filter the blood. If you look at carefully the glomerulus of the kidney, you can see one branches of the artery go through this one, and one venous branches get the blood out. So the blood goes through the glomerulus and get the filter out, and then all the substance need to be eliminated will get out, and anything the body need to keep it, they will stay in the blood. For instance, red cells, all the protein, all the glucose will be keep inside the blood stream, but the rest will be moved out. The uric acid, any other urea, and the oxalate, that extra, anything extra, including salt, will be really balanced out to get out of the urine system. So the kidney function is amazing in the way that it functions throughout so many years. So that's why when people get older and older, you can see what happened to the kidney. When they fail to function, then the physicians have to rely on the artificial kidney, they call dialysis. With dialysis, do the same thing like the kidney do. Even though the machine is so big, but the kidney is so tiny, but they have the same function. They can do the same thing and filter the blood, go through this one, and to keep the kidney function. So this is how we know about the kidney function, including the urinary tract system.
Would you please tell us how many types of kidney stones there are and what really causes us to have these stones in the kidneys?
We have many different kinds of stones, depending on the combinations of the substance in the urine. But mainly in the daily life practice, you can see 4 different types of the kidney stones. The first group is the calcium. The calcium divided into 2 groups, calcium oxalate. Remember, we have 2 chemicals in there. It's calcium and oxalate. Calcium comes from food, and the oxalate comes from vegetables. Now, the second group is called uric acid stones. Uric acid is really the byproduct of protein. Protein means relate to meat, the broth that we eat, fish, and anything that relates to protein, including soybean. So when we eat a lot of meat and protein, the uric acid will increasing in the urine. So therefore, they can form called uric acid stones. The third group of stones is very important. They call struvite stones, mostly caused by infection, because infection in the urine tract system causing scar in the kidney, and all the substance will accumulate in that scar and forming called Stacon stone, they call struvite stone. And lastly, genetic related kidney stone is cystine stone, because the patient have the defect in the genetic system that release a lot of cystine in the urine and forming cystine stone. So this is the different type of stone that we want to talk more about today.
Dr. Tran, according to many medical literature's information, advise the patient that if they have kidney stone, they need to know what type they have. So how important it is for them to know what kind of stone they have?
I think the question is so important because not just the patient need to know what types, but the physician need to know, because the physician provide the treatment. And you can see, we just talk about different kinds of stones. And different type require different kind of treatment, including diet and medication. So both the physicians and the patient need to know exactly what kind of stone. But the problem is sometimes they couldn't really figure out exactly what kind of stone, because if luckily the patient pass out one stone, they have to keep it so they can send over to the lab to analyze the structures of the stone. Now, in the case that they cannot have the stone like that, they have to go inside to do the endoscopy, and maybe hopefully they can get a small piece of stone to analyze information, or they during surgery have to keep that. Now, if they cannot do it, then they have to analyze the 24-hour urine. The patient will go to the lab and get the containers to get the urine for 24 hours. Then the lab will analyze how much is chemical, how much waste system into the urine, to analyze whether they have more calcium, more uric acid, or more oxalate, in order to give the physician some information in order to help patient how to prevent, how to change the diet. This is the key question that everybody needs to know about kidney stone.
Dr. Tran, so how do we know when we have the kidney stone? What are the symptoms that we experience?
The symptom is low back pain. And everybody is believed that when they have the back problem, Mostly they're thinking about the kidney, especially Asian group. But it's back pain doesn't mean it's kidneys or kidneys related to kidney stones, because they have some characteristics of the kidney stones. Remember, the kidney stone only one side. That's mean kidney only move one side, and they're only causing problem when it's so small, and they move down the ureter and causing obstruction. Then the patient develops very severe pain, they call it colicky pain. It's terrible pain that really more than any kind of back problem. And then the characteristics of that pain is they move down from the flank to the anteriorly and go to the bladder area. Different from the back problem from the disc, the back pain usually from the back go down to the leg and go to the buttock. It's not like the kidney stone. And usually the kidney stone accompanied with the fever, or they can see blood in the urine. So we have 4 characteristics of kidney stone. It's severe, from the flank go down anterior to the bladder, with the blood in urine, and also may have fever. So this is how the physician can look at these symptoms and maybe thinking maybe they may have the kidney stone.
So how do you know that for sure if the patient have kidney stone? What kind of diagnosis that you use for?
When the physician is concerned about kidney stone, the first thing they have to check the urine. If the urine confirms there's the blood in the urine, most likely the patient may have kidney stones. And the second thing they have to do is to order the x-rays. Regular x-ray usually can detect the stone with calcium, because the calcium is usually very radiodense. They call radio-opaque. And the regular x-ray can detect the stone. But sometimes with the ureter cyst stone, they cannot detect the ureter cyst stone or cystine stone. Therefore, the next step is to order the ultrasound of the kidney and the bladder. So hopefully with the ultrasound, they can detect different kinds of stones in the urinary tract system. Sometimes, even though ultrasound, they cannot detect this very tiny little stone causing obstruction. Therefore, they have the order called spatial CAT scan to screen for stone. So the radiologist may order a spatial CAT scan. They slide the body into millimeters of thickness in order to figure out whether they can detect a small stone with the size about 0.5 or 0.6 centimeters of the stone. So that's all the technology right now. Hopefully, we can find out exactly where the stone is.
Dr. Tran, now let's talk about treatments. Would you please share with us when do the patient take the oral medication, and when do they need to have a special procedure to treat the kidney stone?
We have 2 different scenarios. Number one is sometimes the stone will detect accidentally by the x-rays and during the other exam. Then different, but when patient came with the acute pain from the stone because of obstruction, then the first thing they have to do is to drink a lot of waters to push the stone move down to the bladder. If you can see on the screen, the stone will move slowly, and when they go to the bladder, the pain will be gone completely. Now, during that time, the patient may take some kind of medication, have to relax the muscles of the urinary tract system. Hopefully, they open up the lumen so the stone may move down easily. That's the acute phase. Now, if all the medications or the drinking of fluid doesn't really move the stone down, then the next step they have to take they call lithotripsy. They use a special machine that you can see on the screen. They lay on the exam table, and the machine will locate exactly where the stone and try to looking for the stone. And using shock wave to go through the skin, go deep into the kidney to break the stone. And hopefully the patient may pass the stone with large amount of water. Now, if the lithotripsy cannot break the stone, then they have to use the technology called the ureteroscopy. That means they use a little instrument to get into the bladder and looking for the ureter, go deep inside and looking for the stone and remove it with the basket or some other technology, then mostly is done by the urologist or the one who specializes in the disease of the urinary tract system. Now, if they cannot do it, they can go directly to the skin, they call percutaneous nephrolithotomy. They go directly to the kidney, open up the kidney, and break the stone and take it out. Lastly, it's rarely done nowadays because there's surgery. If the stone is so big, they cannot break it, they cannot remove it. They have to open up the body and open up the kidney to remove the stone. So these are the commonly technology used to treat the kidney stone at a different level.
Now, Dr. Tran, beside these above procedure that you mentioned, are there any new device, any new techniques that been updated using to treat kidney stones?
Right now with the new treatment, usually they use the fiber optic instrument. Does mean they can direct the endoscope easily in different angles so they can look at the ureter easily and using the laser beam to break the stone, or using the other technology like basket to remove the stone. But with the flexible endoscope like this, they can go up to the kidney and go up to the levels of the kidney to looking around and remove all the stones in the kidney as well. So right now with that, I think that's the new technology using nowadays in different institutions.
Dr. Tran, would you please talk a little bit more in detail how oral medication that treat kidney stone?
The medical treatment of the kidney stone is important because different stones have different requirement of the diet and medication. For instance, first we're talking about the calcium oxalate stones. Now you can see calcium oxalate have two components there, calcium and oxalate. The first requirement of the treatment is to reduce the amount of salt intake. Why is that? Because the more salt we eat, they will push the calcium out to the urine. Therefore, the people who really eat of salt, they will losing calcium because calcium will excreted in the urine. When the amount of calcium increasing, the concentration increasing, they have a high risk of having a calcium stone. Now, secondly, they have to really eat enough calcium in their nature. That's the second requirement. The third group is they have to reduce the food that contain a lot of oxalate. Mostly green vegetables like spinach and broccoli and nut, they have to reduce that because the more oxalate in urine, they may form the calcium oxalate stone. And lastly, they have to use potassium citrate in form of the pill called uracil, or they can using citrate into the citrus juice, mostly in lemon juice. Citrate is very important because the citrate helps urine and to reduce the numbers of stones in the urine. That's the characteristic of the oxalate. That's the first stone. Now the second group of stone is called urethric stone. Urethric stone is the byproduct that we mentioned earlier. It's the byproduct of protein. So therefore, the patient has to reduce the number of protein they eat every day. Very important. And then they have to use medication like allopurinol or uroloric to reduce the number of uric acid in the blood. And thirdly, they're still able to use potassium citrate. That's mostly found in the lemon juice. For the third group of struvite stones, usually caused by infection, mostly they require surgery to remove stone because stone usually is so big, and then they have to take antibiotic for a long time to prevent the recurrence of the struvite stone. And lastly, the cystine stone, usually they have to take a special medication called mercaptopropionate glycine in order to reduce the cystine in the urine, in order to reduce the stone. So this is basically the principle using to treat different kinds of stones.
Dr. Tran, you just mentioned that when the patient have the calcium oxalate stone, you advise them to eat enough calcium. Number one, can you explain about eating enough calcium oxalate? Number two, what is the amount for calcium that a patient needs to have? And what happens if a patient eats more than the amount that needed for our body? What would happen?
Well, this is a very interesting question, and because remember the requirement to treat the calcium oxalate is the patient have to eat enough calcium in the nature. Now remember, two different kinds of calcium. The calcium found in the regular food like milk, cheese, or shellfish, or any seafood, usually contain more calcium than regular food. the requirement that the patient have to eat more calcium in nature. Why is that? Because the calcium in nature have a tendency to combine with oxalate in the guts and the intestine. So the calcium won't let the oxalate absorb to the intestine to go to the kidney. So therefore, the person have to eat enough calcium in nature. Doesn't mean that they have to eat a lot. Because, for instance, if they eat a lot of calcium, for instance, if they take a lot of calcium supplement that's selling in the market, like Citracal or Caltrate, if they take more than 1 gram a day, according to the National Health studies, if people take more than 1 gram a day for a long time, and for so many years, they run the risk of having kidney stone as well. So remember, too much do harm, but too little also may cause a problem as well.
According to the reason that caused the kidney stones beside the generic one, the records show that the younger generation, the people whose younger age start getting kidney stone. What happened to these people? What caused them to have kidney stone?
The young generation have different issues related to that. Number one, maybe they eat more salt than regular people. With all the food that we eat right now in the market, mostly very salty. They put a lot of salt in the popcorn, they put a lot of salt in the crackers and potato chip and things like that. So the amount of salt they're eating every day is much higher than the normal people that build up more calcium excrete into the urine. And number two, the amount of meat they eat sometimes is more than regular normal people, because the big amount of protein may produce more uric acid. Therefore, the young people really eat a lot of meat and things like that. They may have tendency of having more stones. Or they don't drink enough waters. They prefer soft drink. They prefer to drink not regular waters. And I think that's the reason why, and we have more people getting more kidney stones.
Before closing the show, would you please give the audience some advice on how effectively prevent having kidney stones?
Basically, we have 4 things that we need to remember. Try to drink a little more water. Just plenty fresh water and reduce protein, mineral of meat, fish, and shellfish. And remember also reduce the salt in the food. Very important because it prevents a lot of things in the future, hypertension and water retention, things like that. And also very important, they drink a lot of citrus juice. Citrus juice is mainly lemon juice and also some orange juice as well. Lemon juice is very important to prevent the stones because the citrate play a very important role in dissolve all the stones in the urine.
Thank you, Dr. Tran. That's all the time we have for Medical News Show today. Thank you for joining us.
Yeah, thank you for watching our show today. Remember, all information we have today is based on the current knowledge and medicine. Now, medicine will keep improving and progressing in the future. So the more study they do, the more knowledge we know about the disease. And hopefully, the information we provide today may be not correct anymore in the future. But this is the basic information that you need to know to deal with the very common disease, the kidney stones.
Thank you, Dr. Tran. That was Dr. Sang Tran, who just shared with us the information on the kidney stone and its updates new. We hope the information that provided by Dr. Sang Tran has shed more light on the kidney stones. That is all the time we have for the Medical News Show today. If you have any additional question about any of this information, please contact your family physician. Thanks for watching. I am Tu Kim Lam. We'll see you next time on the Medical News. Until then, have a good one.